You've probably heard someone say, "Don't get scaling. It'll make your teeth loose." But what if I told you that's actually a dangerous myth? In fact, avoiding scaling might be the very reason your teeth are in danger. In the next few minutes, I'll reveal the truth behind dental scaling and why it's not only safe, but essential. Stay with me till the end. The truth will surprise you. What is dental scaling? Animation of a tooth with plaque and tartar buildup. Before we dive into myths and facts, we first need to understand what dental scaling actually is. Many people have heard the term, but have no idea what happens during the procedure. And that's where the fear often begins. Let's clear that up right now. White heavy checkmark definition of dental scaling. Dental scaling is a professional cleaning procedure that removes plaque and tartar, also called calculus, from your teeth, especially from areas your toothbrush can't reach, like below the gum line. That it's usually performed by a dentist or dental hygienist using ultrasonic scalers or hand instruments. Microbe. Why is scaling needed? Our mouths are full of bacteria. After every meal, these bacteria mix with saliva and food particles, forming a sticky layer called plaque. If plaque isn't removed regularly by brushing and flossing, it hardens into tartar within 24 to 72 hours. Once tartar forms, you can't remove it at home. Only a dental professional can. Tartar buildup can lead to gum inflammation, gingivitis, periodontal disease, infection of gums and bone, bad breath, tooth loss. In severe cases, scaling helps prevent all of this. Magnifying glass. Tilted left. How is scaling done? Step by step, let's walk through the process so you know exactly what to expect. Step 1. Examination. The dentist first examines your teeth and gums using a mirror and probe. They look for tartar, plaque, bleeding gums, and signs of gum recession. Step 2. Removing plaque and tartar using either a manual scaler or an ultrasonic scaler. The dentist carefully scrapes away tartar from tooth surfaces between teeth below the gum line, subgingival area, backhand index pointing right. Ultrasonic scalers use high-frequency vibrations and water spray to break up tartar efficiently. Step 3. Root planing, if needed. In cases where tartar has gone deep under the gums, your dentist may perform root planing, a process of smoothing the roots of your teeth to help gums reattach and heal. This is common in patients with gum disease. Step 4. Polishing and rinsing after scaling. The teeth are polished using a rotating brush and gritty toothpaste to smooth surfaces and remove stains. Then your mouth is rinsed thoroughly to flush away debris. Step 5. Fluoride treatment, optional. Sometimes, a fluoride gel or foam is applied to help strengthen your enamel and reduce sensitivity. Adult medical symbol. Types of scaling. There are two main types of scaling. 1. Supragingival scaling removes plaque and tartar above the gum line, common in regular dental cleanings. 2. Subgingival scaling removes plaque and tartar below the gum line, necessary in cases of gum disease or deep pockets. Both are safe when done correctly by a trained dental professional. 1 o'clock. How long does it take? Scaling usually takes 30 to 60 minutes, depending on how much tartar you have, whether it's a routine cleaning or deep scaling, how many teeth are involved, your overall gum health. Grimacing face. Is scaling painful? For most people, scaling is not painful. You may feel slight discomfort or sensitivity, especially if you have inflamed gums, deep tartar exposed roots. To manage this, your dentist may use topical anesthetic, numbing gel, local anesthesia, and deeper cleanings, soothing water spray during ultrasonic scaling. Backhand index pointing right after scaling. You might feel temporary sensitivity to hot or cold, but this usually fades within a few days. Soap scaling versus regular brushing. What's the difference? You might think, I brush twice a day. Isn't that enough? The answer is, not always. Brushing and flossing remove soft plaque, but they can't remove hardened tartar. Once tartar forms, it becomes tightly bonded to your enamel and roots, and only a dental scaler can remove it. Skipping scaling is like ignoring rust on metal. It only gets worse. Light bulb. Important reminder. Scaling does not damage enamel. This is a major misconception. The tools used in scaling are designed to remove tartar, not enamel. Your enamel is the hardest substance in the human body, far harder than plaque or tartar. Scaling, when done correctly, does not scratch or weaken enamel. What it does remove is the harmful layer of tartar that causes gum infection, bone loss, and eventually, tooth loss. White heavy checkmark. Who needs scaling? Almost everyone benefits from scaling. but especially people with bleeding gums, smokers, diabetics, people with dry mouth or poor oral hygiene, those who haven't had a dental visit in 6 months or more, even children may need scaling if plaque buildup is present. Spiral calendar: how often should you get scaling? For most people, every 6 months is ideal for a professional cleaning. Those with gum disease or high tartar buildup may need it every 3 to 4 months. Now that you know what scaling is, how it works, and why it's necessary, let's tackle the real issue: the fear and myths that stop people from getting it done. Because in the next section, we'll dive into all the things people think are true about scaling and why most of them are completely false. Myths about scaling. Debunked one by one. A worried person talking to a friend outside a dental clinic. Don't do scaling. Your teeth will become loose. You'll get sensitivity forever. It ruins your enamel. Sound familiar? If you've ever considered dental scaling, chances are you've heard one or more of these scary warnings. These myths, though popular, are completely false and rooted in misunderstanding or fear. Let's now break down the top 7 myths about dental scaling and expose the truth behind each one. Red circle myth number 1. Scaling makes your teeth loose. This is by far the most common and most dangerous myth. The truth: your teeth might feel slightly loose after scaling, but that's because the tartar that was holding them unnaturally in place has been removed. Think of tartar like cement holding a fence in place, but that cement is infected and rotting everything around it. Removing it lets the fence stand on its own. Similarly, scaling allows your gums and bone to heal and support your teeth naturally. In fact, leaving tartar in place will eventually lead to actual tooth loosening and loss because it destroys the bone around the teeth. Backhand index pointing right. Fact: scaling doesn't loosen teeth. Gum disease does. Red circle myth number 2. Scaling removes enamel. This myth is a huge misunderstanding of the tools used. Dental scalers, both manual and ultrasonic, are specially designed to remove soft plaque and hard tartar, not enamel. Enamel is incredibly hard, even harder than steel in some ways, and scaling instruments simply glide over it while breaking off tartar. Backhand index pointing right. Fact: scaling does not scratch or damage healthy enamel. When done by a trained professional, it is 100% safe. Red circle myth number 3. Scaling causes permanent sensitivity. After scaling, some people feel temporary sensitivity to cold or hot drinks. But this does not mean the treatment is harmful. Here's why it happens. When tartar is removed, areas of the tooth that were previously covered are now exposed, especially if the gums had receded due to infection. This can cause mild sensitivity for a few days, but the real cause is the underlying gum disease or bone loss, not the scaling itself. Sensitivity often improves within 1 to 2 weeks, and your dentist may provide desensitizing toothpaste or fluoride treatment to help. Backhand index pointing right. Fact: any sensitivity is temporary and treatable, and it's actually a sign your gums are healing. Red circle myth number 4. Teeth become weak after scaling. This myth is closely tied to the idea of enamel removal, but it deserves its own spotlight. Some people believe that once the tartar is gone, the teeth feel lighter or hollow, and assume that means they're weaker. In truth, your teeth were never meant to carry a heavy load of tartar. Tartar is a harmful invader, not a structural support. Your teeth aren't weak after scaling. They're just clean. Backhand index pointing right. Fact: scaling strengthens your dental foundation by removing bacteria and allowing gums to reattach. Red circle myth number 5. You only need scaling if you have cavities. This is a common belief, and completely wrong. Cavities and gum disease are 2 separate issues. Cavities are caused by acids breaking down the enamel. Gum disease is caused by tartar and bacteria irritating and infecting the gums and bones. You can have 0 cavities and still need scaling if there's tartar buildup, bleeding gums, or bad breath. In fact, many people with perfect teeth suffer silently from periodontal disease because they skip scaling. Backhand index pointing right. Fact: even healthy-looking teeth can hide deep gum problems. Scaling is still essential. Red circle myth number 6. If my gums bleed during scaling, it means it's harming me. Bleeding gums during scaling might look scary, but they're usually a sign of existing gum inflammation. When tartar irritates your gums, they become swollen, red, and bleed easily. When your dentist begins to clean, the touch of instruments may trigger bleeding, but it's not caused by the scaling. It's caused by the disease. After scaling and proper care, the bleeding typically reduces within days. Backhand index pointing right fact. Bleeding is a symptom of gum disease, not a side effect of scaling. Red circle myth number 7. Once I've done scaling, I don't need to do it again. Many people think dental scaling is a one-time procedure. But just like you don't shower once a year, you shouldn't think of scaling as a one-and-done treatment. Plaque starts forming again just minutes after brushing, and tartar can begin forming again within days. The longer you wait between cleanings, the more it builds up. Most people need professional scaling every 6 months, and those with gum problems may need it even every 3 to 4 months. Backhand index pointing right fact. Scaling is a regular part of dental maintenance, not a permanent fix. Crossmark myth white heavy checkmark truth scaling loosens teeth gum disease does. Scaling helps prevent its scaling removes enamel proper scaling preserves enamel scaling causes sensitivity is temporary and treatable teeth become weak after scaling teeth. Become stronger and cleaner only people with cavities need scaling. Scaling is for everyone. Even cavity-free bleeding during scaling is bad. Bleeding indicates gum disease, not damage. One scaling is enough. Regular cleanings are essential. Confident patient leaving the dental clinic smiling. So the next time someone tells you, scaling will ruin your teeth, you can confidently say, actually, it saves them. Now that we've exposed the false beliefs around dental scaling, let's move on to the real truth backed by science. In the next section, we'll explore what scientific research and dental experts have to say about the safety and importance of dental scaling. Scientific facts. Why scaling is safe. It's one thing to say scaling is safe, but it's another to prove it with science. In this section, we're going to look at what research studies, dental experts, and global health authorities have to say about dental scaling. Spoiler, it's not only safe, it's essential. White heavy checkmark 1. What do dental associations say? Let's start with the most trusted voices in oral health. Hospital American Dental Association, ADA. Dental scaling is a critical preventive treatment that helps manage gum disease and maintain healthy gums and teeth. The ADA recommends professional cleaning every 6 months for most people and more frequently for those with gum issues. Hospital World Health Organization, WHO. Periodontal disease is a major global health burden. Regular professional cleaning is a proven method to prevent it. Hospital British Dental Association, BDA. Scaling removes hardened plaque and prevents further deterioration of the supporting structures of the teeth. Backhand index pointing right. In short, scaling is universally recognized and encouraged by global dental authorities. Test tube 2. What do clinical studies show? Several clinical studies have been conducted over the years to test the effectiveness and safety of dental scaling. Book study. Journal of Clinical Periodontology, 2008. Researchers followed patients who had scaling and root planing done. Results showed white heavy checkmark reduced gum bleeding, white heavy checkmark less pocket depth, white heavy checkmark healthier gum attachment, white heavy checkmark no damage to enamel. Conclusion. Scaling effectively improves gum health without harming tooth structure. Book study. International Journal of Dental Hygiene, 2014. This study evaluated ultrasonic scaling tools and their effect on enamel. When used by trained professionals, ultrasonic scalers do not cause any measurable loss of enamel. Book study. Cochrane Oral Health Review, 2020. This global meta-analysis reviewed multiple trials involving scaling and found white heavy checkmark regular professional cleaning reduces gingivitis and plaque. White heavy checkmark safe for long-term use. White heavy checkmark significantly lowers the risk of tooth loss due to gum disease. Backhand index pointing right. Takeaway. The science is very clear. Scaling prevents disease and is 100% safe. Gear 3. How scaling supports gum and bone health. Gum disease, periodontitis, doesn't start with pain. It starts silently with tartar buildup. Here's how scaling helps stop it. 1. Removes bacterial colonies that trigger inflammation. 2. Eliminates toxins under the gum line. 3. Prevents gum detachment from teeth. 4. Stops bone loss by controlling infection. 5. Allows gums to heal and reattach without scaling. This bacterial attack continues, destroying bone and gums, and by the time symptoms show, the damage is usually advanced. Backhand index pointing right. Scaling is like removing termites before they destroy your house. Brain 4. What happens if you skip scaling? Skipping scaling can lead to prohibited tartar buildup, prohibited bleeding gums, prohibited bad breath, prohibited gum recession, prohibited bone loss, prohibited loose or falling teeth. These aren't guesses. They are well-documented outcomes of untreated periodontal disease. Fact: tartar doesn't just sit on your teeth. It invades your gum tissue, and scaling is the only way to stop it. Brick 5. Enamel. Stronger than you think. One reason people fear scaling is the idea that tools might scratch or damage enamel. Let's break that myth with actual science. Test tube enamel hardness rating. Enamel. 5 on Mohs hardness scale, steel dental scaler. 2.5. 3 tartar. Much softer than enamel, but harder than plaque. This means scaling tools are physically incapable of damaging healthy enamel under normal use. Backhand index pointing right enamel is stronger than gold, bone, or iron. Scaling removes harmful debris, not your enamel. Repeat button 6. Healing response after scaling. Proven benefit studies show that after a successful scaling treatment, white heavy checkmark inflamed gums begin to shrink back to normal. White heavy checkmark pocket depth, space between tooth and gum. Reduces white heavy checkmark bad breath, improves significantly. White heavy checkmark biting pressure becomes more even. White heavy checkmark risk of tooth loss drops sharply. Even people with moderate to severe gum disease show improvement within 2 to 4 weeks after deep scaling. Chart decreasing 7. Scaling reduces long-term health risks. You might be surprised to know oral health is linked to general health. Tartar and infected gums increase the risk of heart disease, syringe diabetes complications, brain Alzheimer's, pregnant woman pregnancy issues like low birth weight. By reducing inflammation in the gums, scaling lowers the total inflammatory burden on the body. The mouth is the gateway to the body. Keeping it clean protects your entire system. Speech balloon real dentist opinions. Let's hear what real professionals say. Dr. John Brooks, periodontist, USA. I've seen patients lose teeth not because of scaling, but because they avoided it for years. Dr. Amina Patel, BDS, UK. Scaling is not cosmetic. It's preventive medicine. Done right, it saves smiles and money. Dr. Muhammad Rashid, Pakistan. One of the most rewarding things in dentistry is seeing how just one cleaning can completely change a patient's oral health. Evidence-based benefits of scaling. White heavy checkmark scientific benefit magnifying glass tilted left study / source reduces gum bleeding. Journal of Periodontology 2008 preserves enamel. International Journal of Dental Hygiene 2014 lowers risk of tooth loss. Cochrane Review 2020 improves gum healing. ADA clinical guidelines reduces inflammation. WHO Oral Health Reports improves general health. Harvard Health Review 2017 Scene transition. Bright visuals, smiling patients leaving clinic. So when someone says scaling is dangerous, you can confidently say the science says otherwise. Dental scaling is one of the most proven, researched, and safest dental procedures, with decades of data and millions of smiles saved. What to expect during and after scaling. So, let's say you've decided to finally go for your scaling appointment. Good choice. But now you're probably wondering, what exactly will happen during the procedure? Will it hurt? What will my teeth feel like after scaling? Don't worry. In this section, we'll walk you through everything you can expect before, during, and after dental scaling. That way, you'll feel calm, informed, and totally prepared. Stop sign before the procedure. Preparation. There's usually no special preparation required for a basic dental scaling. However, your dentist or hygienist will. White heavy checkmark. Ask about your medical history. White heavy checkmark. Check if you're taking blood thinners. White heavy checkmark. Ask about sensitivity or previous dental issues. White heavy checkmark. Check your x-rays. If recent, white heavy checkmark. Examine your gum pockets using a probe. In some cases, especially for deep scaling, they may numb your gums using a local anesthetic. Gear during the procedure. Step-by-step experience. Here's how it typically goes. 1. Initial examination. The dentist checks your mouth using a small mirror and explorer tool. They inspect the gums, look for tartar buildup, and identify areas of inflammation or deep pockets. Sweat droplets. 2. Scaling begins. The dentist uses either manual instruments, scalers and curettes, or ultrasonic scalers, which use high-frequency vibrations and a water jet to dislodge tartar. You'll hear a vibrating or buzzing sound if ultrasonic tools are used. This is completely normal. The water spray keeps the tip cool and flushes debris. You might feel gentle pressure or scraping A tickling vibration, occasional water spray, or suction backhand index pointing right important. Scaling may feel odd, but should not be painful. Soap 3. Polishing after removing all tartar. Your teeth are polished using a soft rubber cup and gritty paste. This helps remove surface stains and makes your teeth feel smooth. Gemstone 4. Fluoride treatment. Optional. Some dentists offer fluoride gel or foam to strengthen enamel and reduce post-scaling sensitivity. Stopwatch: how long does it take? Mild plaque buildup. 20 to 30 minutes moderate to heavy tartar. 45 to 60 minutes full mouth deep cleaning. With anesthesia, may require 2 sessions. Grimacing face after the procedure. What you may feel. 1. Slight tooth sensitivity. You may experience temporary sensitivity to cold air, hot/cold foods, or drinks, brushing, or flossing. Light bulb why. The newly exposed tooth surfaces were previously covered with tartar or inflamed gums. 3 o'clock. This sensitivity usually lasts a few days to a week and gradually fades. Your dentist may recommend white heavy checkmark desensitizing toothpaste like Sensodyne, white heavy checkmark fluoride mouthwash, white heavy checkmark avoiding very hot/cold drinks for a few days. 2. Gum soreness or mild bleeding. Your gums may feel slightly swollen, tender to touch, lightly bleeding when brushing for the first few days. Light bulb. This is normal and improves as the gums heal. 3. Cleaner, smoother teeth after scaling. Your teeth will white heavy checkmark feel noticeably smoother, white heavy checkmark look brighter, removal of stains. White heavy checkmark have no rough tartar edges, white heavy checkmark taste fresher. Many patients say it feels like a reset for your mouth. Green salad post-scaling care tips to ensure proper healing and long-term results. White heavy checkmark brush gently with a soft bristle brush. White heavy checkmark floss daily. Wait 24 hours if gums are sore. White heavy checkmark use lukewarm salt water rinse. Half a teaspoon salt in warm water. Twice a day. White heavy checkmark avoid smoking, spicy foods, and alcohol for 24 to 48 hours. White heavy checkmark stick to soft foods if your gums are sensitive. White heavy checkmark drink plenty of water to keep your mouth hydrated. Adult medical symbol. When to call your dentist. Call your dentist if you experience warning: excessive bleeding, more than a few hours. Warning: severe pain that doesn't improve. Warning: swelling or pus from the gums. Warning: fever or bad breath that worsens. These are rare, but may indicate a deeper infection needing attention. Thinking face: will I need follow-up appointments? Most dentists recommend a routine cleaning every 6 months, more frequent visits every 3 to 4 months. If you have gum disease, in some cases, deep scaling with root planing is done in multiple sessions. Dental scaling is a safe, painless, and essential procedure that keeps your teeth and gums healthy. Knowing what to expect removes fear and makes the experience more comfortable. Instead of dreading the dentist chair, think of scaling as a spa day for your mouth. Coming up next, we'll tie everything together and bust the final myth about scaling in our conclusion. You started this video wondering, is scaling bad for my teeth? You may have heard myths, fears, and stories that made you hesitate. But now, armed with knowledge, science, and facts, the answer is crystal clear. No, scaling is not bad for your teeth. It's one of the best things you can do to protect them. Let's recap what we've uncovered. Magnifying glass tilted left: what the evidence shows. Heavy checkmark scaling removes harmful plaque and tartar. Heavy checkmark, it prevents gum disease and tooth loss. Heavy checkmark, it does not damage enamel. Heavy checkmark, it does not loosen healthy teeth. Heavy checkmark, any sensitivity is temporary and treatable. Heavy checkmark, regular scaling leads to healthier gums, fresher breath, and stronger support for your teeth. Prohibited: the real enemy isn't scaling. It's ignorance and delay. What causes loose teeth, gum recession, and bad breath? It's not the dentist's tools, it's the bacteria and tartar allowed to fester under the gums. Why avoiding professional cleaning. People unknowingly allow the real danger, gum disease, to silently destroy their smile from the inside out. Brain. So, what should you do now? If you haven't had a dental cleaning in the last 6 months, calendar schedule one now. If you notice bleeding gums, bad breath, or buildup, tooth, don't ignore it. If someone tells you scaling is harmful, graduation cap, educate them with the truth. Direct hit final message from Mr. Teeth. At Mr. Teeth, our mission is to give you the truth about your oral health, not myths, not fear, because a healthy mouth means more confidence, better health, and a smile that lasts a lifetime. So, don't fear the scaler. fear the tartar, and fight back with the truth, with science, and with regular dental care. Well, don't forget to subscribe for more myth-busting dental content. Thumbs up like this video if it helped you. Speech balloon, comment below if you have questions. Outbox tray, share this video with someone who's afraid of dental cleaning. Thank you for watching. And remember,